Well, there are lots of things that change as we age, and one of them is our eyesight.
Some of the changes are normal and to be expected, but others could be signs of a bigger problem. Here with more is Dr. Veena Rao with Charlotte Eye, Ear, Nose and Throat Associates. Dr. Rao, good morning. Thanks for being here today.
Good morning. Thank you for having me.
There are some normal things that we should expect with our vision as we age. You know, we get around 40 and then we start needing those reading glasses, correct?
Exactly, definitely.
So some of that stuff is just normal.
Yes, a lot of it's normal. I mean, our eyes, like the rest of us, just change as we get older. And I usually tell people there are about 3 points in life where we're going to notice some changes. And so the first is kind of obvious. When we're kids, growing up, as we grow, our eyes grow. And so most of us figure out whether we need glasses or not by about high school or so. Now, after that, usually we get to enjoy pretty stable vision for a long time. And it's around the mid-40s or so that, like you mentioned, the reading glasses, it gets harder and harder to see up close. And that's just because our eyes lose some of our fine focus. So if you don't need glasses, or you haven't needed glasses before, trip to the drugstore, getting some to try on, and then find what works for you. If not, you can't find something, let us know. We can help. But usually that does the trick.
Okay.
And then folks who already wear glasses, it's a time to go get an update. And we may need to start thinking about putting in something more like a bifocal or a no-line bifocal.
Okay.
So one of the things that kind of really militates against you having your really good eyesight, you said dry eyes and irritation. Is that correct?
Yeah, that's exactly right. So one of the things that can also make you blurry is just the eyes getting dry as we get older, and it's common. And so most people with dry eyes come in saying their eyes feel dry, but other people just notice blurriness. They say, I don't feel dry, it's blurry. A good way to check for that, if you can blink, blink, blink and make your vision better, you're probably dry. And so it's easy to go just to the drugstore, get some little artificial tears eye drops, try on both eyes, a drop or two, 1, 2, 3, 4 times a day, see what helps you. Another good kind of home remedy is making a hot compress. The washcloth, hot water, put it over your closed eyelids for a minute or two, and it actually does a really good job refreshing your eyes.
Oh, very good. Okay, so some of these things are common, but there are some instances in where we may need to see a doctor, correct? And one of those is droopy eyelids. Talk more about that.
Sure. So over time, gravity gets to the best of us, and so the eyelids can sometimes get droopy or saggy. But I think one thing that people may not know is that if they get so droopy that it seems to get in the way of your vision, you have to open your eyes like this or try to hold them up, there are actually very simple surgeries or procedures that can just remove that extra skin. Insurance actually will cover that if it's bothering your vision. And so it's helpful. You don't have to struggle through it.
Another one is called floaters. What is floaters?
Yeah. Have you ever had the little tiny spots floating in your vision?
Oh, yeah. The little, okay, yeah, I do. Okay.
Most of us do. And, you know, the back of our eyes filled with the clear jelly. When we're born or when we're kids, it's all jelly. As we get older, and it starts pretty early for some people, even 20s, 30s, 40s, it's not even getting old, we see those little pockets of jelly, they start turning into liquid. It's the little spots. The reason why you want to pay attention to those little spots of jelly floating in liquid is if they come on suddenly. Because like I said, most of us get them and they're no big deal. But if you have a whole bunch of new little floating spots in your vision or bright flashing lights, that could mean that the jelly and liquid's moving around a lot in the back of your eye. And sometimes that can pull or tug on what we call the retina, which is the nerve in the back of the eye. That could be a problem.
Okay, so if you notice that, go see a doctor. Also, cataracts. You definitely need to come in and see a doctor, for sure.
Right, and you may not know if you have cataract or not, but the thing that you would notice, we kind of talked about 3 stages in life, it brings us to the last one. You know, as we get older, sometimes the vision just gets hazy and you don't quite know what's wrong. Driving at night can get tough, vision's blurry, and that might be cataract. So if you see us, like you said, we can tell you whether it's just glasses or whether it's cataract. Good news about cataract is we have great techniques, great surgeries that can help clear that up and get you seeing well again.
Very good. Dr. Rao, thank you so much. For more information, visit WeJustMakeSense.com, WeJustMakeSense.com, or call Charlotte Eye, Ear, Nose and Throat Associates at 704-295-3000. Again, 704-295-3000. We appreciate your time.
Thank you.